Hello and welcome back to my video on eating disorders. What are eating disorders? Eating disorders are behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associated distressing thoughts and emotion. They can be very serious conditions affecting physical, psychological, and social function. Types of eating disorders include anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder, other specified feeding and eating disorder, pica, and rumination disorder. Eating disorders affect up to 5% of the population, most often develop in adolescence and young adulthood, especially anorexia nervosa and bulimia nervosa are more common in women, but they can also occur at any age and affect any gender. Eating disorders are often associated with obsessions with food, weight, or shape, or with anxiety about eating or the consequences of eating certain foods. Behaviors associated with eating disorders include restrictive eating or avoidance of certain foods, binge eating, purging by vomiting or laxative misuse, or compulsive exercise. These behaviors can become driven in ways that appear similar to an addiction. There are various types of eating disorders ranging from simple to complex ones that severely affects the health of an individual. Let us discuss some very common eating disorders. The first one in the list is anorexia nervosa. Anorexia nervosa is characterized by self-starvation and weight loss, resulting in low body weight for height and age. It is a very serious condition. Body mass index, a measure of weight for height, is typically under 18.5 in an adult individual with anorexia nervosa. Dieting behavior in anorexia nervosa is driven by an intense fear of gaining weight or becoming fat. Although some individuals with anorexia say that they want and they are trying to gain weight, the behavior is not consistent with this intent. For example, they may only eat small amounts of low calorie foods and exercise excessively. Some persons with anorexia nervosa also intermittently binge eat and are purged by vomiting or laxative misuse. There are two subtypes of anorexia nervosa. The first one is restrictive type, in which individuals lose weight primarily by dieting, fasting, or excessively exercising. And the second one is binge eating or purging type, in which persons also engage in intermittent binge eating and purging behaviors. Over time, some of the following symptoms may develop related to starvation or purging behaviors. The most common symptoms are menstrual period cease, dizziness or fainting from dehydration, brittle hairs and nails, cold intolerance, muscle weakness and wasting, heartburn and reflux in those who vomit, severe constipation, bloating, and fullness after meal, stress fractures from compulsive exercise, bone loss resulting in osteopenia or osteoporosis, depression, irritability, anxiety, poor concentration, and fatigue. The nutritional plan should focus on helping individuals counter anxiety about eating and practice consuming a wide and balanced range of foods of different calorie densities across regularly spaced meals. For adolescents, the most effective treatment involves training parents to support and monitor the child's meal. Second eating disorder we are going to discuss is bulimia nervosa. Individuals with bulimia nervosa typically alternate dieting or eating only low calorie safe foods with binge eating on forbidden high calorie food. Binge eating is defined as eating a large amount of food in a short period of time associated with a sense of loss of control over what or how much one is eating. Binge eating behavior is usually secretive and associated with feelings of shame or embarrassment. Binges may be very large and food is often consumed rapidly beyond fullness to the point of nausea and discomfort. Binges occur at least weekly and are typically followed by what are called compensatory behaviors to prevent weight gain. These can include fasting, vomiting, laxative misuse, or compulsive exercise. Possible signs that someone may have bulimia nervosa include frequent trips to the bathroom right after meals, large amount of food disappearing, or unexplained empty wrappers and food containers on the floor, chronic sore throat, swelling of the salivary glands in the cheek, dental decay resulting from erosion of food enamel by strong stomach acid, heartburn and gastroesophageal reflux, laxative or diet pill misuse, recurrent unexplained diarrhea, misuse of diuretics, feeling dizzy or fainting from excessive purging behavior resulting in dehydration. Outpatient cognitive behavioral therapy for bulimia nervosa is the treatment with strong evidence. It helps patients normalize their eating behavior and manage thoughts and feelings that perpetuate the disorder. The third eating disorder I'm going to discuss is binge eating. As with bulimia nervosa, people with binge eating disorder have episodes of binge eating in which they consume large quantities of food in a brief period, experience a sense of loss of control over their eating, and are distressed by their binge behavior. Unlike people with bulimia nervosa, they do not regularly use compensatory behaviors to get rid of the food by inducing vomiting, fasting. Unlike people with bulimia nervosa, however, they do not regularly use compensatory behaviors to get rid of the food by inducing vomiting, fasting, exercising, or laxative misuse. The binge eating is chronic and can lead to serious health complications, including obesity, diabetes, hypertension, and cardiovascular diseases. Some of the signs of binge eating are eating more rapidly than normal, eating uncomfortably full, eating large amounts of food when not feeling hungry, eating alone because of feeling embarrassed by how much one is eating, feeling disgusted with oneself, depressed, or very guilty afterward. As with bulimia nervosa, the most effective treatment for binge eating disorder is cognitive behavioral psychotherapy for binge eating. Interpersonal therapy has also been shown to be effective. The next eating disorder we are going to discuss is other specified feeding and eating disorder. This category includes eating disorders or disturbances of eating behavior that cause distress and impair family, social, or work function, but do not fit the other categories listed here. Example, the frequency of binges in bulimia or binge eating disorder or the weight criteria for the diagnosis of anorexia nervosa are not met. An example of other specified feeding and eating disorder is a atypical anorexia nervosa, individuals who may have lost a lot of weight. An example of other specified feeding and eating disorder is a atypical anorexia nervosa, individuals who have lost a lot of weight and whose behavior and degree of fear of fatness is consistent with anorexia nervosa, but who are not yet considered underweight based on their BMI because their baseline weight is above average. Avoidant restrictive food intake disorder, AFID. Avoidant restrictive food intake disorder is a recently defined eating disorder that involves a disturbance in eating resulting in persistent failure to meet nutritional needs, and extreme picky eating. In outlet, food avoidance or a limited food reporter can be due to one or more of the following: low appetite and lack of interest in eating or food. Extreme food avoidance based on sensory characteristics of food. Example, texture, appearance, color, and smell. Anxiety or concern about consequences of eating, such as fear of choking, nausea, vomiting, constipation, and allergic reaction, etc. This disorder may develop in response to a significant negative event, such as an episode of choking or food poisoning, followed by the avoidance of an increasing variety of foods. If it does not include food restriction related to lack of availability of food, normal dieting, cultural practices such as religious fasting, or toddlers who are picky eaters. Food avoidance or restriction commonly develops in infancy or early childhood and may continue in adulthood. Regardless of the age of the person affected, it can impact families, causing increased stress at mealtime and in other social eating situations. Treatment for AFID involves an individualized plan and may involve several specialists, including mental health professional, a registered dietitian, nutritionist, and others. Pica is an eating disorder in which a person repeatedly eats things that are not food with no nutritional value. The behavior persists over for at least 1 month and is severe enough to warrant clinical attention. Typical substances ingested vary with age and availability and might include paper, paint chips, soap, cloth, hair, strings, chalk, metals, pebbles, charcoal, coal, or clay. Individuals with pica do not typically have an aversion to food in general. The behavior is inappropriate to the developmental level of the individual and is not part of the culturally supported practice. Pica may occur in childhood, adolescence, or adulthood, although childhood onset is most common. A person diagnosed with pica is at risk for potential intestinal blockages or toxic effect of substances consumed. Treatment for pica involves testing for nutritional deficiencies and addressing them if needed. Behavior intentions used to treat pica may include behavior interventions used to treat pica may include redirecting the individual from the non-food items and rewarding them for sitting aside or avoiding non-food items. Rumination. Rumination disorder involves the repeated regurgitation and rechewing of food after eating, whereby the swallowed food is brought back up into the mouth voluntarily and is rechewed and reswallowed as spat out. Rumination disorder can occur in infancy, childhood, and adolescence or in adulthood. To meet the diagnosis, the behavior must occur repeatedly over at least 1 month period, not be due to gastrointestinal or medical problem, not occur as a part of one of the other behavioral eating disorders listed above. Rumination can also occur in other mental disorders. However, the degree must be severe enough to warrant separate clinical attention for the diagnosis to be made. Thanks for watching.